Approximately 100 million adults in the United States may suffer from chronic pain. So with us today to discuss this immensely relevant topic is pain specialist Dr. Paul Christo, also the host of radio show Aches and Gains. Love that name. Welcome, Doctor. Good to meet you.
Thank you.
I want to talk about this because, you know, it may seem self-evident, but what exactly is chronic pain?
Pain can be a normal sensation, Danielle, and it's also a warning signal. It tells us that we have or may have hurt ourselves. But chronic pain is different. A patient of mine said to me, "I woke up after spine surgery with low back pain that I thought would go away. 8 months later, it was still there and getting worse."
Oh boy.
So if pain continues and doesn't get better, the nervous system no longer responds to sensation in the same way. The injury has healed, but the nerves where the injury occurred, the spinal cord, and even the brain become dysfunctional. Today, pain specialists are now thinking of chronic pain as a disease itself, rather than a symptom of other diseases.
You know, it's interesting. I read a statistic that said approximately 100 million people may be suffering with chronic pain. I thought that to be really surprising. 1/3 of our country's population. What kind of chronic pains, doctor, are the most common?
According to a National Institute of Health survey, low back pain was the most common. In fact, back pain is the leading cause of disability in Americans under age 45. Other common types of chronic pain are cancer pain and arthritis. The economic costs are staggering. According to the latest Institute of Medicine report, chronic pain costs the nation up to $635 billion each year in both medical treatment and lost productivity. And pain will touch all of us at some point during our lives.
How informed do you think are most people suffering with chronic pain about pain management, options, or even better ways to live with the pain?
You know, Danielle, most people don't have enough information on how to control chronic pain and don't know who to turn to for help. One of my patients saw 5 doctors in specialties other than pain. They weren't prepared to offer her effective treatments. The chronic nature of her pain gradually made her give up. But she didn't realize how much she had given up because it's not an overnight process. It wasn't until we started doing nerve blocks, giving her pain medicine, and using some unique holistic approaches that she felt better.
You know, it's interesting because I'm thinking a lot of women, we tend to ignore chronic pain because we're dealing with our families and our kids and all other kinds of things and forgetting about ourselves. And I know there is a web-based resource out there providing information for people who do suffer from chronic pain. Tell me about that.
Sure. The website is partnersagainstpain.com. Partnersagainstpain.com provides tools for patients to better communicate with their doctors, describes integrative therapies like biofeedback and hypnosis, shows us how to measure and track pain, and highlights vulnerable populations in pain, like older adults, patients with cancer pain, and those who served in the military. There are also materials on the website that can be downloaded by patients, caregivers, and healthcare professionals.
When it comes to chronic pain management, who really is the driving force, would you say, as we move forward?
Time and time again, patients tell me that they have needed to take charge of their own care. Patients have to demand the best treatments from doctors who have the expertise in the specialty. I tell all my patients to have eternal hope and that we'll search together until we've found a program or therapy. And if you're a patient, I urge you to work with your healthcare provider to decide on the best option for you.
I love that. Don't ignore that chronic pain. That is the message here today. For those who suffer from chronic pain or have loved ones who do, what can they expect as the collective effort moving forward?
I think there's great hope for managing pain with appropriate treatment. I have more and more patients whose lives have become examples of what can be done. There are current therapies that can help them with their pain, emerging therapies that we're just beginning to explore, and exciting new therapies on the horizon.
Well, you have really given us some great information this morning. I will never ignore my chronic pain, and I hope people out there get that same kind of feedback. And I know your radio show that you have is going very well for you. What kind of patient-consumer feedback are you getting from listeners in the market? Are you realizing there are more people out there who may be suffering from chronic pain and may not have even known it or known what to do about it?
Great feedback. Listeners of the show have told me that they have found real solutions for their pain, and that's really gratifying. Aches and Gains has really reached a lot of people. 80,000 listeners and has over 44,000 podcast downloads from all over the world. My celebrity guests share stories of how to overcome pain, but so do real people who live with pain day after day.
We had a good conversation here today. Thank you so much for taking time out of your busy practice and, of course, away from your radio show to talk about this very relevant topic. So good to have you here with us this morning.
Well, thank you very much for having me, Danielle. I really appreciated the offer, and I asked your viewers to visit partnersagainstpain.com.
Certainly will do that. Thank you. Pleasure to meet you.
Thank you.